If we were to move a little bit more away from that and go, I suppose, more to a more specific topic, it's something that I've had a lot of questions on. And obviously, when I had the treatment on myself, many questions that I get are about mercury. And obviously, this is quite a divisive and topic, and one that creates quite a lot of argument at the moment, and not just in dentistry fields, but in all holistic health fields. Where do you stand, or what's your opinion on mercury fillings, or silver fillings as we know them as, and whether they should be taken out, whether they should be left in, and so on, and just wondering your opinion on that.
Okay, well, a very good starting point is to say that we're living now in such a more enlightened age. I think when the mercury debate came out in the early 80s, I remember Princess Diana had all her amalgam fillings removed, and that caused a lot of controversy because of her public profile. And then this fear that maybe really mercury fillings have to be removed from everybody's teeth. And I'll be the first to say it's a personal choice. I think you have to listen to your heart, listen to your instincts, and decide if that's really something for you. But where I stand, and I think where all well-informed people will stand, is that we all know that mercury is a material we don't really want to have within our vicinity. So when I opened my practice, I decided make sure I'm not going to use the material. So I was trained with the material, very skilled at using it if I had to, but haven't really used it for 20 years in other practices, but in my own practice I haven't used it at all. So I just know that it's sensible to, with the modern materials that we have available, that we don't need to use amalgam anymore. So I think that is well accepted within dentistry now. Most dentists don't want to be putting a grey or a black filling into patients' mouths. So on a cosmetic level, there is no demand for amalgam. On a cost-effective level, there is now very little demand for amalgam, because it used to be a very cheap and cost-effective product, but newer products are coming in to replace amalgam that can be placed just as quickly and last almost as long. So 20, 30 years ago, that wasn't around, so there was still then quite a difficulty in promoting mercury-free dentistry, because it was more expensive, for example. The other big issue is that removing amalgam, in my opinion, the material needs to be quarantined and treated in a very, very waste disposal mentality. So there needs to be a philosophy of extreme barrier mentality, just like asbestos is extremely barriered off when it's removed from buildings.
Which I obviously went through.
Yeah.
When we had mine removed.
I know you showed a photograph, and something I've always been very strong on is if you're going to do this kind of work, you've got to at least be barriered around your mouth. I personally would like to see, unless someone's very claustrophobic, a nasal inhalation mask, just for either medical air or pure oxygen, so that you're inhaling good quality air, not mercury vapor. Because I think it's well documented that the two most important times when mercury is released from an amalgam filling is when it's placed and then when it's removed. Research is also showing little by little that it is slowly leaking and dissolving. And you show me a non-precious metal alloy that doesn't slowly corrode over 20 years or 30 years. And I suppose if we're sucking on them on a day-to-day basis, surely some of that mercury is going into our system. The big debate is it really affecting our health? And I think that's why you either make your decision on whether you want to do this, or if nothing else, get cleverly tested to see and elicit if there is an impact on your cellular level. Because there are many mineral and sort of body tests that can be done to look where heavy metals are in our system. So we can measure in our hair, in our urine, in our feces. And there are some specific companies around the world that will do very highly skilled, highly diagnostic tests to elicit if there is a mercury issue.
So I suppose one of the things that I often hear from, I suppose, more orthodox approach is that the minute the mercury filling or silver filling hardens, it therefore is no longer a problem.
Sure.
And this is the argument that often comes to
Absolutely.
Me when one of my clients maybe has quite a few fillings and maybe suffering with headaches or maybe suffering with fatigue or gastrointestinal problems. And when you mention that maybe that could be a root cause, and if they've tried many other forms, osteopathy, physio, so on, and they're not working, and you think, well, maybe this is somewhere where you need to look at your lifestyle. How is it that someone can say, no, it's absolutely safe, it's absolutely fine, once it's hardened it's not doing anything, yet some other people within the field would say, no, it definitely needs to come out. Now obviously, personally, from my opinion, I'm in the latter.
Sure.
Just from I know how I feel since I've had them removed. But it's a difficult position. It's a difficult question. Like you were saying there, I understand you saying it's a position where you have to know yourself.
Yeah.
But I think the decision I made was to have one removed and see how I felt.
Definitely.
And for me, it was this portion of my head felt lighter.
Oh, yeah, I remember you saying
And I said that to you at the time, which for me was a no-brainer.
Yeah.
So then it was like, well, if I feel that much better, my stomach almost calmed down.
Wow.
And then I think we went through actually using probes to show that mine was
Electrical
active.
probes. Yeah.
And for me, that was enough.
Exactly.
So maybe that would be the thing to do. Would you suggest?
Well, we always start off with an electrical evaluation, because I personally think some of the significant transformation that occurs on a removal of amalgam is nothing to do with the fact that it's mercury that's been removed. It's the fact that a galvanic product has been removed from our teeth. We basically house these teeth in a cranium that's full of our electrical material. We all know it's the brain. That's basically a massive computer that's very susceptible to electrical currents. So if we have a galvanic cell in our mouth, then there's a huge potential for that to disrupt our frequencies and disrupt our brain energies. So for no other reason, if there's an instant, I feel lighter kind of feedback, or I just feel brilliant after treatment, maybe just removing some electromagnetic pollution from my mouth could be the significant cause of that symptom improvement. I really feel that anybody that's looking for mercury issues to be resolved just from having their teeth refilled are on the wrong track. They would need to consider either detoxification programs before an amalgam removal process, but especially afterwards, because it's like all heavy metals, lead and mercury in particular, are very pervasive and hold on in our fat cells very easily, and it takes a long time for us to really remove, and maybe never can be fully removed. It's a long journey, and we need to live a more detoxification and rejuvenation orientated lifestyle, a wellness lifestyle. And I suppose that's why I tend to attract patients who want this treatment, because I don't think I attract just general routine patients who have got tooth decay and who have poor management of their gums, for example, who then suddenly say, well, my amalgam's removed. They've usually been on a journey of getting to better health by improving their oral health, seeing a hygienist, for example, finding out how to keep their mouth exceptionally clean. They're understanding their diet and nutrition issues, and how sugar in particular can cause so much havoc in the body and rot our teeth for sure, but the acid-alkaline imbalances that occur from refined foods and sugars that are eaten on an excessive level can then really cause so much disease or dis-ease in our mouth and in our general systems. If we don't deal with all that before the amalgam issues, then really we're doing, in my opinion, in the wrong syntax or in the wrong sequence. So I tend to have patients arriving to me already in that mindset. They've already been on a 1-year journey, maybe a 5-year journey, sometimes even a 10-year journey of gradually getting to the level when they want their amalgams removed. They may have had some teeth removed that were very septic, or other dentistry that was septic in their mouth, had that treated first. And then I suppose, to me, it's then the ultimate level. If you've got electrical interferences in your mouth, slowly leaking mercury possibly into your mouth, why wouldn't you want to at least consider replacing that in a very safe way, in a very controlled way, at your pace, not doing it all at once, like I hear some people doing. They just go into these clinics and just have all their teeth blitzed. If you're not careful, you can go from what we call the frying pan into the fire. Just by taking a filling out, whether it's a mercury one or a non-mercury one, there can be irritation and inflammation in our dental nerves called the pulps. So really, we don't want to be changing too many fillings all at once, just for the sanity of our teeth, let alone potentially the risk of biochemical and environmental issues and damage if we're taking too many fillings out, certainly unsafely, and exposing our body to a higher dose of mercury, for example. Fantastic.